Hello, everyone, and welcome. This Wednesday, we're discussing high cholesterol, and we're going to be talking about specific foods that can help. High cholesterol is a very common condition. Unfortunately, there are no symptoms, so many people don't know that their cholesterol is high. But having high cholesterol raises the risk of heart disease, which is actually the leading cause of death worldwide. Also increases the risk of stroke, which is also the fifth leading cause of death. So high cholesterol is a very important topic that needs to be addressed. You're listening to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care, which is in Sugar Land, Texas. And here we offer stress-free healthcare with a direct approach to the doctor so that our patients can get the care they need without the inconveniences or the delays in the traditional care system. You can learn more about our services on our website, www.intouchprimarycare.com. And if you have not already, please hit that subscribe button. This helps us get the word out so that we can get people the information, this important health information. And today is our 1 year anniversary on this platform. So just if you want to wish us happy anniversary and say anything about the episodes, if they've been helping you, please go ahead and do so, as this will encourage us to keep going, and hopefully it's helping. So let's get into today's topic. What is cholesterol? So cholesterol is a waxy fat-like substance. It's produced by the liver. It's found in the blood, and everyone has some, and it's actually needed. Cholesterol is important for good health. The problem is when people have too much of the bad cholesterol. So there are people that have what we call LDL, which is a bad cholesterol, or triglycerides, which is also associated with, increased risk of heart disease, or when people have too little of the good cholesterol, which is the HDL. So people that have high LDL, that's also known as bad cholesterol, high triglycerides, and have low HDL have a higher risk of heart attack, stroke, and other health problems. And the higher the level, especially of the bad cholesterol, the higher the risk for these types of conditions. So there are many things that affect your cholesterol. For example, we know that exercise has an impact on your cholesterol. If you exercise even 10 minutes a day, it can help to reduce your cholesterol levels over time. You want to try to increase that time incrementally, but just starting where you are. If you do smoking will be the first thing we want to work on, because you would definitely want to quit smoking if you have high cholesterol. And then even stress can affect your cholesterol. So especially with chronic stress. So if your cortisol level is high all the time because you're stressed, it actually increases your cholesterol levels, which does not help. So there are things that, can definitely affect cholesterol, but diet is definitely the one with the most impact other than smoking. So particularly the fats in our diet. So our cholesterol levels are very much affected by what we eat. To better understand this, let's talk about how types of fat in our diet, because that's really what affects our cholesterol. So there are three main types of fat that we talk about: saturated fat, unsaturated fat, and trans fat. Okay, so saturated fats. Saturated fats are mainly found in animal products, so things like meats, dairy, cheese. Saturated fats are not good for us. They actually raise bad cholesterol, but they actually also raise our good cholesterol. But because they raise our bad cholesterol, they're not so good for us. The other type of fat, unsaturated fat, there are two types. There's the monounsaturated fat and the polyunsaturated fat. So the monounsaturated fat is also found in animal products, but there are plant sources of monounsaturated fats too. So plant sources include avocados, nuts, seeds, and plant oils. And these are the best because they lower our bad cholesterol and triglycerides, and then they raise the good cholesterol. So monounsaturated fats are good for us. So things like, again, avocados, nuts and seeds, plant oils are good for us. Polyunsaturated fats is the other type of unsaturated fat. And this, you may have heard of omega-3 fatty acids. That's where it belongs in this group. There is also omega-6 fatty acids that belong in this group too. These polyunsaturated fats can be good for us because they also lower the bad cholesterol, but they also lower the good cholesterol. So the best type of fat is the monounsaturated fat in the unsaturated fat category. So we've talked about saturated fat. We said that from animal products, not so good for us because they increase bad cholesterol. And then we said there's monounsaturated fat and polyunsaturated fat, which monounsaturated fat is the one we want because of what it does with lowering the bad cholesterol and the triglycerides and also increasing the good cholesterol. And then the third category is the trans fat. Now, trans fat are very bad for us because they raise our bad cholesterol and lower our good cholesterol. So we don't want that. So when you're looking at any kind of product and or food, packaged food, you can look for these things on the package. How much saturated fat does it have? How much monounsaturated fat? How much polyunsaturated fat? And basically just really focus on if it has a lot of saturated fat, then you probably don't want to, you probably want to avoid it or look for another food that has a lower content of saturated fat. If it has monounsaturated fats, then that's something that you're probably, more likely to want to take. So a key thing to lower cholesterol will be try to replace the saturated fats, which are animal products, with monounsaturated fats as much as you can. So you want to get those from plants, nuts, seeds, oils, and then you want to avoid trans fat. So that will be kind of a general guideline. More polyunsaturated fats, more unsaturated fats, less saturated fats, no trans fat. So that could really help. So how do you do that, practically speaking? So as I mentioned, diets will impact our cholesterol the most. The first thing is limiting processed foods because a lot of processed foods will have saturated fat in there. Also, even what do you use to cook? Like what kind of oil? Switching to a monounsaturated fatty oil like olive oil, which is the one that has been studied the most and found to have the greatest health benefits. There are other plant oils like peanut oil and canola oil, but there are other things that make those ones not as good of a choice as olive oil. Also, adding fish to your diet can be helpful since it contains some of the good fats, the omega-3 fatty acids that we're looking for. And also avoiding, meats as much as you can, or if you do have meat, make sure that a lot of the fat is being trimmed off. You want to do low-fat foods as much as possible, and then increasing, your vegetables, your whole grains, your fruits can be very helpful as well. So the way I would recommend, and this is something I work with my patients, and I always encourage, this is just medical information. Everyone needs to go back to their doctor and have this discussion about how it works for them personally. So one of the things I do with my patients, though, is I start by adding things instead of taking away things, right? Because when you have conditions like high cholesterol, many times it comes with other conditions like diabetes, hyperpressure, and things like that. And sometimes it's frustrating for the patient because they don't know what they can eat, right? It seems like there's so many restrictions. So we usually start by adding. So we start by adding foods that are high in fiber from fruits, vegetables, whole grains. And so things like oatmeal, almonds, okra, even eggplants can be helpful. So start by adding something to your diet. So you don't need to feel so restricted, but make it something that will help with your cholesterol. You can also add foods that are high in unsaturated fat, so like nuts and seeds, like flaxseed, chia seeds, which are very easy to add onto a salad or even a smoothie. So you could do that to improve, just start by doing that. Even just doing that is a step in the right direction. There are also some supplements that can be helpful in diet, so like supplementation with plant stanols or sterols, which can be naturally occurring in some of the things we've already talked about, like nuts, legumes, whole grains, fruits, vegetables. All these things contain plant stanols and sterols, which help with cholesterol. But they're also specifically manufactured foods like margarines, for example, that are out there that contain plant stanols and sterols to help lower cholesterol. So that's something that some people use to help because it has been shown to reduce bad cholesterol. And usually, if you're doing it with a low saturated fat diet. There's also red yeast rice, which is a common supplement that has been used to lower bad cholesterol. It actually has a compound that is similar to a statin, the monocolin K is a substance, is a compound found in red yeast rice, and it's similar to lovastatin, which is a cholesterol medications. So cholesterol medication. So that has also been shown to lower cholesterol by bad cholesterol by about 20 to 30%. So speaking of statins, some people will still need to take this medication for high cholesterol. And again, you need to check with your doctor. Statins are the most common prescribed medications in the US, with more than 40 million Americans taking them. They are known to lower cholesterol, but now we have more information about how it actually positively affects heart health, specifically our vessels. So if you are taking cholesterol medication, do not stop it. Always check with your doctor. I've seen too many people stop their medicine without, the proper controls, and it causes long-term problems. So please check first. If you are in the Houston area and you are looking for a doctor to help, with your high cholesterol, or who is proactive about your care in general, we're here for you at In Touch Primary Care. You can learn more about our services on our website, or you can call us 713-280-9985. We look forward to helping you on your journey towards better health. So there's so many benefits of making lifestyle changes to improve cholesterol. Apart from preventing heart disease and strokes, you feel better. You reduce your concern for side effects. You may even be able to lower your medicines, of course, with your doctor, with your doctor's help. So very, very good thing to try to do. And that's it for today. And if you know anyone with high cholesterol, please share this episode with them. You never know how much of a difference it could make for them. All right, I will see you next week at 2:15 p.m.